Throughout American history, women have been an integral part of the U.S. military, serving since the time of the American Revolution. Some women even fought in combat by disguising themselves as men during both the American Revolution and Civil War. However, women who were disabled during the Civil War, Spanish-American War, and World War I had to fight for the right to receive proper care and treatment at veteran hospitals and care homes. In 2023, we commemorate a significant milestone: 100 years since women veterans began receiving healthcare services at VA. We pay tribute to all those who have devoted their efforts tirelessly over the years to ensure that the women who served our country are provided with the healthcare they earned and deserve. On September 14, 1923, VA's predecessor, the National Home for Disabled Volunteer Soldiers, approved its first hospital spaces for women veterans who served as nurses during World War I. These spaces were at the Soldiers' Home in Danville, Illinois, and Milwaukee, Wisconsin. Of the 52,000 women veterans in America following World War I, 25% were either totally or partially disabled, and therefore eligible for care. By the time the National Homes became part of VA in 1930, more hospitals had been constructed and opened to care for all veterans.
1945.
VA began hiring women physicians who specialized in the care of women veterans.
1946.
Dr. Margaret D. Craighill became VA's first chief medical consultant on women veterans' medical care and appointed the first 10 women doctors at VA to treat women veterans.
1948.
The Women's Armed Services Integration Act allowed women the right to permanently serve in the regular armed forces. It also limited the proportion of women in the military to 2% of the enlisted force and 10% of officers. This limit was repealed in 1967.
1973.
With the end of the draft, the removal of the limit on women in service, and the beginning of the all-volunteer force, the military began recruiting more women because there were not enough qualified men volunteers to meet the needs of a volunteer military. At that time, there were approximately 45,000 women serving on active duty.
1983.
The Veterans Healthcare Amendments to Title 38 created the National Advisory Committee on Women Veterans to assess women veteran issues and make recommendations to improve healthcare for women.
1988.
To expand on needed services for women across VA, Tony Lowry helped establish the Well Woman's Clinic at Bay Pines, Florida. She and Peggy McAlonis, both Army nurses in Vietnam, began hosting week-long innovative training programs for the role that would become Women Veterans Program Managers. VA's National Women Veterans Health Program was established under the leadership of Dr. Susan Mather.
1990.
The VA in Saginaw, Michigan was renamed after Alida Lutz, becoming the first VA facility named after a woman veteran. This represents an important step in recognizing the significance of women veterans. The early 1990s were a historic time for women in the military, with over 40,000 women deployed in support of the Gulf War, making women service members more visible in the public eye.
1992.
The Defense Authorization Act repealed combat exclusion laws that prevented women from flying combat aircraft. VA continued to expand gender-specific services and general reproductive health care to eligible women veterans. VA also began providing counseling and treatment for conditions related to sexual assault or harassment that happened to veterans during their time in service.
1996.
The first National Summit on Women Veterans Issues was held, marking the first time women veterans from across the nation had the opportunity to come together with policymakers and VA leaders.
2001.
Following 9/11, the population of women in the military deploying and serving in combat grew rapidly, as did their visibility, partially due to the availability of media coverage. Throughout the 2000s, women became the fastest-growing demographic in the veteran population.
2008.
To ensure each VA maintains and builds upon health programs for women veterans, VA establishes a full-time Women Veterans Program Manager position at each medical center.
2010.
VA policy mandates at least one women's healthcare provider at every site of care, so women veterans do not always have to travel to a main hospital for their specific care.
2011.
To spread awareness about VA healthcare services for women veterans, the Women Veterans Call Center was launched.
2013.
Department of Defense removed gender-based barriers to service, opening the door for women to serve in all roles of the military.
2017.
To improve women veterans' experiences at VA medical centers and make facilities welcoming for all, VA implemented end harassment programs.
2022.
3 more VA medical facilities were named in honor of women who had exceptional achievements during their service. VA's mission never stops growing, changing, and adapting to ensure that every veteran can feel like they belong. VA has recently made an important change to support this inclusion.
Today we're bringing our mission statement into the moment, embracing the fullest meaning of President Lincoln's sentiments, promise, and unquenchable passion to care for every single veteran. Going forward, VA's mission statement will read, to fulfill President Lincoln's promise to care for those who have served in our nation's military and for their families, caregivers, and survivors.
In the United States today, there are approximately 2 million women veterans, with over 600,000 of them receiving quality medical care from specially trained staff at VA facilities each year. Now, more than ever, women veterans belong at VA. We encourage you to see for yourself all the progress VA has made in caring for women veterans over the last 100 years. To read more about the historical advances VA has made in women's health care, visit womenshealth.va.gov/history.